Hi, everyone. Welcome to After the Diagnosis, a webinar series presented by the Neuroscience Family Advisory Council at Boston Children's Hospital. In this webinar series, we'll be talking to patients, caregivers, and providers about diagnoses that we face and giving a completely different perspective on them. Today, in this episode, we're going to be discussing pediatric stroke and therapeutics after stroke. We have 3 different participants, each with a different background, and we're super excited to get started. So we'll start with introductions. My name is Dylan Kirch. I'm a clinical research assistant in neurosurgery and the co-chair of the Neuroscience Family Advisory Council. I came to be where I am. I was a patient when I was 17. I was treated under neurosurgery. And after that, I started with my passion into medicine, joined NFAC, and later joined the research team. But I'm not the important one today. You guys are. I'm really excited to be here to talk to you. So first, Dr. Rivkin, tell me about you. What was your path to where you are, and how did you find yourself interested in neurology?
Well, thank you very much. I became aware that I was interested in neurology very early in my training. I enjoyed neuroanatomy the most during medical school of all the subjects that I took. And then in my first residency, I realized that I enjoyed taking care of children who had neurologic difficulties. It was later during my second residency in neurology and child neurology when I really became fascinated by adult stroke. And interested not only in the acute insult to the brain, but how the brain recovered from that injury. And so when I got to child neurology, I was equally interested in all the plasticity and the ability of the young brain to adapt to injury and to adapt developmentally. And that took me directly to childhood stroke.
Wonderful. Dr. Vanderpluym, you are a cardiologist by training, correct?
Yes.
Tell us kind of about how, you came from cardiology to a stroke center. That's quite an interesting path.
Yeah, so it's not the standard pathway of somebody entering the field of stroke, but I am a trained pediatric cardiologist, and my specialty is actually in heart failure as well as mechanical circulatory support, which are these like miniaturized pumps that can be used to help support patients who are critically ill. An unfortunate complication related to being really sick with heart conditions is that you can have a stroke. And unfortunately, many of my patients over my, early career suffered strokes. But what really impressed me was the amount of recovery that many of these patients would show. And so based on kind of my early just exposure to patients who unfortunately had to have strokes, I decided to kind of pivot in my career to find strategies that we could reduce, ultimately prevent stroke in children with cardiac conditions. And I think from there, we've kind of expanded my career in looking at what are different types of medications, like blood thinner medications that can be used, and applying those lessons to kind of all kids with different types of stroke.
Wonderful. Thank you. And last but certainly not least, Jane, tell me about your path to being a social worker and how you came to be interested in neurology and in stroke.
Yeah, definitely. So funny enough, social work is actually my second career. I used to work in finance.
Okay.
Yeah, but before coming to children's, I worked for about 5 or 6 years in a residential education program where I worked primarily with youth doing behavioral health, focusing on trauma and attachment and educational supports. And so when I decided I was ready to move on to a new challenge, I think the stroke center social work position seemed like it would be a really good fit for me because it allows me to still focus on my passion of, mental health and supporting folks with different mental health challenges while looking at all of the other, tangible and intangible barriers that come up in the whole medical diagnostic experience.
Wonderful. I think the second career is so I'm a second career person too. I thought I wanted to be a lawyer, and here I am. So tell me, guys, about the Stroke and Cerebrovascular Center. What do you treat, and in specific, why come to this center? I think, one of the things that is super important that we discussed is this idea of long-term interdisciplinary care. So tell me about the center, what that looks like, and how care is provided, long-term to families and to patients. And I'll let whoever wants to take it off first go.
Maybe I'll start with
Please.
with that. A number of years ago now, we were impressed by how little existed for the care of children who'd had stroke. And at the same time, we were very impressed by how the need for care, both in the acute period, as well as in the subacute and chronic periods of stroke, required not just one field like neurology, but a number of different experts in clinical care to optimize the outcome and the rehabilitation for each child. So really, at the very initial point, we in neurology partnered with hematology to start the stroke and cerebrovascular program here. And that has grown to become a center at Boston Children's Hospital. And the center serves as an umbrella to bring together a myriad of clinical disciplines for one reason only, and that is to make each child who's had a stroke as best as they can be after the stroke. And so with that is a recognition that the first stage of treatment is in the hyperacute phase at the time that the child has the stroke. But as I mentioned before, because the young brain has an extended period of plasticity, of adaptation, that is a biologic mechanism that we can use to improve and adapt to the stroke longer than an adult. The care is required over long term and many years. So within our center, we have neurology, cardiology, hematology, physiatry, neurosurgery is in the center as well, neuroradiology and interventional neuroradiology, neuropsychology for cognitive assessment and betterment of children who've had stroke, as well as physical therapy, occupational therapy, and social work.
Oops. I think that's what's so, incredible about the center is that, we're tailoring care to every aspect of the disease process. Dr. Vanderpluym, Jane, do you want to add anything to that?
Yeah, I think one of the biggest challenges with many patients who have had a stroke is that they have other additional competing risks.
Right.
And so while the treatment for a stroke may be giving them an agent that helps dissolve a clot away, those same patients might also be at increased risk of bleeding. And so it's constantly balancing all of these kind of competing risks that could potentially worsen the outcome. And so I think by having this large group who are all specifically looking at what's the impact of our interventions and making sure that it's not only the safest possible, but also the most effective, I think is ultimately what's going to improve the outcomes. And then lastly, we're not just looking at the patient, because when a patient has a stroke, it impacts everybody in their lives. It impacts their family, their siblings, their teachers. And that's really where having somebody like Jane can sometimes have the most impact on the day-to-day lives of our patients.
Yeah, Dr. Vanderpluym, I think that's a great point. Obviously I see families when they come into the stroke center for appointments, but a lot of the work I'm doing is actually when families are at home and embedded in their communities. I think that the diagnosis of stroke or cerebrovascular injury impacts a lot of folks and for a long time. So at whatever point of the life cycle, there's usually something that I can help out with.
Absolutely. Tell me about presentation, because I think, kids are different in the sense that the presentation, if I'm not wrong, is quite different. Like there's not necessarily one sort of presentation for stroke in pediatrics. So are there different types? What are some common symptoms? How do we diagnose that?
Right. So in stroke in childhood, I'd first just point out that there are two different types of stroke generally in children. One is the type of stroke when the brain doesn't get enough blood or oxygen. And as a result, there's injury and death of neurons in brain tissue or in the spinal cord. The second type of stroke is hemorrhagic stroke, in which there is a frank episode of bleeding in the brain, most often due to rupture of a blood vessel, and rupture of a blood vessel that's part of in children an abnormal collection of blood vessels called a vascular malformation. Now, in children with the first type of stroke, the ischemic stroke, that kind of stroke occurs throughout the age range of the child, from birth to 18 years of age. And one fact that many people don't appreciate is that stroke is most common in childhood amongst neonates, newborns. And actually the frequency of stroke in the newborn is as frequent as ischemic stroke is in older adults. So it is a very frequent occurrence. And in those babies, the most common sign of stroke is a seizure within the first 48 hours for birth, but the seizure can occur and has occurred as much as a few days after a child has been. In older children, stroke will present with some of the same symptoms with which it presents in adults. Weakness on one side of the body, weakness on one side of the face, a sudden appearance of a gait disturbance, a sudden appearance of inability to speak or to understand what's said, or a visual abnormality. In kids who've had hemorrhagic stroke, the most common symptoms are mental status change, sudden onset of sleepiness, nausea and vomiting from the bleeding that's occurring in the brain, and headache. And I should just add that the occurrence of seizure in kids with ischemic stroke, we think of it as primarily occurring during the neonatal period, but seizure can be a presenting sign of stroke in children all the way up to about the age of 5. So if a child comes in with a first-time seizure and especially has a weakness in an arm or a leg that wasn't there previously, one should always include stroke on the list of possibilities that might have caused that event.
So then when a child does present, we'll get into kind of the long-term follow-up after, but in the acute setting and when a child is inpatient, Dr. Rivkin and Dr. Vanderpluym, from kind of like a 30,000-foot view, what do treatment options look like? Kind of what is an inpatient stay going to look like for a child with a newly diagnosed stroke?
Christina, would you like to lead on that?
Sure. Or also, why don't you start and then I'll kind of expand out on some of the potential therapeutic options.
Happily. Great. So we at Boston Children's Hospital have actually taken a great deal of time and care to develop a hyperacute pediatric stroke team that can respond to a child who comes into our emergency room or a child on the floor of our hospital who all of a sudden demonstrates symptoms that are very concerning for stroke. And we did that because there were a couple of therapeutic modalities that became available for children to treat the acute stroke when it occurs.
Right.
One is giving a medicine that dissolves the clot in the artery of the brain or neck that has caused the stroke. And the other is the amazing ability to reach inside the body through the arterial pathway with a catheter by a very trained, well-trained neurointerventional neurosurgeon or radiologist, and actually pluck the clot from the inside of the artery and open it up again. These two treatments, if applied within the correct window of time, can literally save brain and alter the course of what would have otherwise been a more worrisome neurologic outcome. So in order to be able to do that, we had to assemble a team of people that could respond 24 hours a day, 7 days a week to make this kind of treatment happen, and to conduct rapidly the evaluation for identifying that there's an obstruction in an artery and that there is a need for acute treatment if the child qualifies. And similarly, I would add that the development of pathways for treatment of children with hemorrhagic stroke is necessary as well, with the help of our colleagues in neurosurgery, because if the blood collection is sufficiently large, then that blood collection needs to be evacuated from the brain.
Sure, sure.
And then just building upon that, beyond the acute period, so even within the first 24 to 48 hours,
right,
this large team is also trying to sort out what was the potential cause of the stroke and start neutralizing any of those risks that could have potentially contributed to it. In cardiac patients, they undergo a multitude of different procedures, be it cardiac catheterizations, surgical interventions. And so all of those events require access into the vessels or into the heart and can be kind of provoking for these types of events. And so we try to understand what was the cause of the stroke and then do further workups of also looking at underlying clotting conditions, imaging of the heart, of the other blood vessels to assess for any other potential clots, and then determining kind of after we've managed the acute event, how are we going to prevent any future events from happening, even in the first few weeks to the rest of their lives.
So then what do rehabilitation options look like after that? And I know we'll definitely get Jane involved here, but what does rehab look like? And kind of that long term, I think people and families, patients always want to know, when can I go back to school? When can I go back to sports? When can I go back to doing what I love? I think that's, a big question for all patients. So curious to hear your thoughts, all three of you, kind of about the rehab process and what it looks like kind of after discharge.
If I could just jump in really quickly to point out something that we haven't discussed yet. And that is that you bring up, Dylan, a really good point about when do you go back to school?
Right.
And I think we realized that when a child has a stroke and has such an acute injury to the brain, it, for almost every child, immediately changes what happens at school. How the learning process occurs, and how that child will learn going forward. So we have a neuropsychologist who has the ability to even begin the neuropsychological, the cognitive assessment
Right.
of each child while they're still in the hospital with an acute stroke. She can come and assess the child, and that already begins the rehab process that begins after the child emerges from the acute hospitalization.
It's like you're already thinking about that, while the child's still inpatient and preparing for discharge.
I think absolutely, because as we mentioned earlier, the young brain is able to adapt better than an old brain.
Right.
So after the injury occurs, even while we're still doing the hyperacute treatment that may happen of thrombectomy or thrombolysis, we're already thinking about how can we change or improve the biological course that neurons in the child's brain are traveling so that we can alter and improve the outcome.
Wonderful. Dr. Vanderpluym, Jane, any more thoughts on rehab, what that looks like?
Yeah, I think in the in-hospital setting, there's obviously a lot of acute things that happen, delivery of medications, needing certain images, things like that. And all of that time period, we're really just trying to make sure that we're treating all of the acute issues. But we really want to look beyond that, because our plan is for these patients to all go back and reintegrate into their lives and not find reasons they can't go back to school, but really find all the reasons to go back into school or to do all of the things that they want to do. And the reality is kind of the best physical therapy and language and feeding and all of those things happens when kids are with their peers. And so really fostering that ability to reintegrate as quickly as possible. That said, everybody's going to kind of require their own personalized approach to it. And so we factor in what type of injury they had, what are some of the anticipated deficits or challenges that they might encounter, and then create a personalized approach. So some patients might have a little bit more language challenges or memory issues, while other kids might have more motor deficits. And so incorporating the right people into their team. And not all of this is going to happen at Boston Children's Hospital, because we realize that not everybody lives within half an hour or an hour of this location. And so we have a lot of satellite locations. We actually provide a clinic out in Waltham that's a little bit easier to access for some families. And then we try to link up families and patients with local occupational therapists, physiotherapists, and support. And that's where Jane also helps establish relationships with the school to kind of foster their return.
Yeah, I think one of the best parts about my job is that I get to do a lot of work in communities where families live. Obviously, I do a lot of work within our team, but I can really act as sort of that liaison for families as they are trying to hit those post-diagnosis milestones, and work with folks in the community and those professionals on our team to create that, specific and personalized plan that helps them get back to, typical functioning, but in a way that is safe and taking into account all of the things that have come before. And I think that it's really important for families to recognize that, like, understandably, experiencing a stroke or having a cerebrovascular injury will feel pretty catastrophic. And for all of our families, this is a new experience for them. But remembering that on our team, we've been doing this for a while, and between all of us collectively, we have a ton of experience and know about a ton of different resources. So while it's not a one size fits all, like, we can help you find what fits best for you.
I love this idea of kind of this personalized approach. My background, both personally and professionally now is in brain injury, and stroke is an acquired type of, it's not a traumatic brain injury, but it is an acquired brain injury. And one of the things that I've always thought, about rehab and about moving back into school is this idea that it's not one size fits all, that every kid and every situation is so different. And so when we talk about, the interdisciplinary care, the fact that we have so many different providers weighing in, and then after the fact, making sure that kids are getting a personalized way of, as Dr. Vanderpluym says, reintegrating, it makes so much sense. And I think it it goes so much farther when it's not just like a blanket, like, okay, here's what we're going to do. This is how we're best going to serve your child, like your family, into making sure that the patient's being reintegrated back into school, which is, as we know, so important for social reasons, for rehab reasons, all sorts of it. So wrapping up here, guys.
So Dylan,
yeah,
I think I'd just like to spring off the very good point that you just made. And and that is to say that is why we developed a clinic where neurologists, physical therapists, physiatrists, occupational therapists, hematologists, cardiologists are all present. So that a child and his or her family comes to be seen and is seen by all the relevant clinicians, and also can be seen by Jane, our social worker, so that we can get all of this started, gather the child in for neuropsychological evaluation if that's needed. And because of that, in addition to seeing children who've had acute stroke and come through our emergency room, or who were already in the hospital to begin with, we also are a good place for families to come for second opinions about overall stroke care for their children and for their families.
Yeah, it's a fantastic point. So wrapping up here, guys, I would love to hear, we usually wrap these episodes up in a pretty standard way. And how we do that is we ask all the panelists, kind of for their one-liner, for like for a parent or a sibling or even a patient who is newly diagnosed with a stroke, what is one thing from your experience that you would tell somebody? So I'll let anybody kick this one off. This is my favorite part of the episode.
Well, I think that if a child and his or her family thinks that the child is having a stroke, get them to a hospital and get medical help as quickly as possible. We in the Stroke and Cerebrovascular Center feel that we understand about stroke, we understand the medical and biological aspects of it, but we also like to think that we understand the emotional and powerful effect that this has on it. And we're here for you. And we would love to try and help you in any way we can.
Yeah, and just building upon that, I think anytime a person has a stroke, it is devastating to themselves and to their family. But what I tell family is that the stroke diagnosis does not define who they are or who they're going to be or what their life holds. That these children are resilient and that we are going to become kind of part of the fabric of their lives now. But if anything, their life can be just as full and amazing as it was before the stroke. And so we have at Boston Children's Hospital moved beyond just letting kids survive whatever disease or conditions that they experience, but really thriving from it. And that's the whole purpose of this center, is to let kids thrive and achieve their highest potential, which is not going to be limited by their stroke.
Yeah, I think sort of going off of what Dr. Vanderpluym just mentioned, in addition to this type of diagnosis being really devastating for families, it can also be pretty isolating. And so as, the mental health professional in the room, I feel like I just want to emphasize that folks don't need to go through this alone, and that there are, within our team and within the community at large, there are a ton of resources for families to feel supported and cared for and stabilized. And we're here to help with that.
Wonderful. Guys, this has been fantastic. Thank you so much for this conversation. For our listeners, make sure to check out the Stroke and Cerebrovascular Center website and the NFAC website linked below, and make sure to look out for future episodes as we continue to talk to all sorts of providers, patients, and families. Thank you guys so much. I really appreciate your time.